Wednesday saw more record high temperatures across the eastern United States. More than 125 million Americans remain under heat alerts right now, with temperatures ranging from 10 to 20 degrees higher than average. Several major cities in the Northeast reached 100 degrees today. It is hot out there. Relief, though, is on the way. A cold front is moving in that will cause temperatures to drop. And apparently, we're also going to see some rain. The Southeast, however, will continue to see above average temperatures and is at risk of severe storms this week. Extreme heat like this, though, the kind that we've seen this week, it can have serious and sometimes even dangerous impacts on people's health. A study published last year in the Journal of the American Medical Association found that more than 2,300 Americans suffered heat-related deaths in 2023. That is the highest number ever recorded. At least 21,000 people have died in the heat in the United States since 1999. To talk about all this, Dr. Eric Legome joins us now. He is the chair of emergency medicine at Mount Sinai Morningside Hospital here in New York City. Doctor, thank you very much for being with us, because even before we started talking about it, I came to you and I said, I was outside for hours yesterday. I felt this, I felt that. So what exactly is the heat doing to our bodies when it's this hot out there?
Sure. So it's a great question. And, as you would assume, because the heat impacts all of our body. So it's not just one organ, one piece. And so the bad things that tend to happen because all of your body is impacted. So the easy things, the things that aren't so bad are heat rash, a little bit of swelling, so your skin gets impacted. But as the temperature gets higher, as the humidity goes up, it can impact all of your organs. It can impact your brain, it can impact your liver, really everything. And so the things that we see are relatively nonspecific at first. People just feel bad. Everything's being impacted. They feel tired, they feel nauseated. And it gets worse and worse. And as they start to have damage, there can actually be deaths from heat, as you mentioned. And as the longer you're in it, the worse it can be.
Sometimes these symptoms can really sneak up on you if you're not paying attention. What should people really be looking out for?
So I think there's two types of bad or concerning heat injuries that people have. So there's one we call the classic, and it tends to occur in people who are older, people who are younger, or people who may not be able to either get out of the heat or feel it as much. And so people on certain medications. And so that is one that usually takes place over a period of time. So that's where you really want to look out for little kids. Look out for your neighbors. Look out for people who are on medications who might not realize things. Tell you to stay away from alcohol, things that may blunt your response. And then there's the kind that come from exertion. So athletes, people working outside, that can happen relatively quickly. So those are the ones that you can do something about if you're young, if you're healthy. You stay outside if you can. You get to air conditioning if you can. But if you're starting to feel that you're starting to feel bad, try to slow down, get out of the heat, make sure you stay hydrated, and do it before you feel thirsty.
Well, if people are going to be out in this weather, though, if they don't have a choice, how can they protect themselves?
So one is, if you're going to be out, if you can, try to do it early or do it late. Stay out of the hottest part of the day. Two, as you talked about, stay hydrated, and you're gonna want to do it before you feel thirsty. If you feel thirsty, it may be too late. So continue drinking throughout the day, but even before you go out, try to drink. Think about your clothing. Don't wear tight-fitting clothing. I know we're in New York. This is not the time for dark black clothing. Light clothing, it helps repel heat a little bit. And it's probably worthwhile to talk to your physician, if you can, about medications you're on. Because not all medications, but many of them impact your ability to either sweat or sweat too much. It may impact your ability to control heat, to get your heart rate up. And so some of the cardiac medications, some of the antibiotics, they all can have effects that can get worse in the heat. So it's worthwhile checking into that and trying to not necessarily stop them, but be a little bit extra careful.
Yeah, I think that's something a lot of people don't think about. We really appreciate your time. Thank you very much, and stay cool.
You too. Thank you very much.